Good morning, everybody. I want to welcome you to the COVID-19 and Parkinson's webinar today. I'm Jody Brown. I'm the Executive Director for the Parkinson Association of the Rockies. We have two fabulous presenters today, and I'm just going to go over a couple of quick items. If you look to the right of your screen, you'll see a couple of handouts that you can download. These are going to be informational about COVID-19 testing. There's also a liability waiver. So if you are not participating in our exercise classes and you do not have a liability waiver, you can actually download that, send that to us, and we can get you a list of virtual classes. I'm going to go over more of what we've put online in virtual at the end of the seminar, so stay tuned for that. And then we also have some information from Abbott about testing and COVID-19 testing. So we want to get this started as quickly as possible because there's a lot of ground to cover. I want to thank Abbott for sponsoring this webinar today. And with that, I'm going to turn it over to Cindy Kirkendall from Abbott.
Good morning. Can everybody hear me? My name is Cindy Kirkendall, as Jody said, and I'm actually the territory manager for Abbott Neuromodulation. And in addition to working closely with the Colorado Movement Disorder Centers and Parkinson's family supporting deep brain stimulation, we also have a vaccine division of Abbott that's been on the front line of fighting COVID-19 over the past several weeks, and wanted to let the group know that on Friday, Abbott received approval by the FDA under what's called an emergency use authorization, and it's a point of care test to detect novel coronavirus in as little as 5 minutes. So this fastest available molecular point of care test will be shipped starting today, and it will be shipped directly to the emergency departments in some of the harder hit areas of the country, and we're hoping to ramp up production to exceed 50,000 tests per day. So just having more testing available will certainly help us slow the spread of the virus. And we'll be keeping the local community posted. Elena will be posting the press release on the website and any updates that we get on availability of the test in Colorado as they become available. So we'll let you know. And at this time, I'd like to introduce our facilitators who so graciously agreed to provide an overview today on COVID and then open it up for questions and answers. I think that many of you have been probably unable to get out to see your own providers during the past couple of weeks. So I think making a personal connection with healthcare providers can be very, very helpful. Dr. Lawrence Seeberger and Dr. Theresa Lee are joining us from the University of Colorado Movement Disorder Center. Dr. Seeberger is Associate Professor in the Department of Neurology at the University of Colorado Movement Disorder Center. She's also the Director of the Movement Disorder Program and Director of the Parkinson's Foundation Center of Excellence, all at the University of Colorado. Dr. Theresa Lee is a board-certified neurologist who's currently completing specialized training in a 2-year fellowship in movement disorders at the University of Colorado. So I want to again thank both of them for taking time and providing their clinical expertise and insight.
Thank you so much for that introduction. Can everybody hear me okay?
We can hear you.
All right, thanks. All right, thank you everyone for joining and for sending questions ahead of time. My name is Dr. Theresa Lee. So I'm just gonna go through some basic background information about COVID-19, what this means for patients with Parkinson's disease. And then as they mentioned, we'll do some question and answer afterwards as well. All right, so just a little bit of background. So coronaviruses are a large group of viruses. They're named for the protein spikes that are on the surface. You can see in the little picture on the left there. And under electron microscope, it kind of looks like a crown. That's why it's called a coronavirus. So COVID-19 is just a new type of coronavirus that's been found in humans. It's mainly spread person to person via respiratory droplets. It is possible to get the virus from touching a surface or object with the virus on it and then touching your mouth, nose, or eyes, but this is not the main way that it spreads. The symptoms are generally a fever, cough, and difficulty breathing, and the onset occurs about 2 to 14 days after exposure to the virus. And the severity can range from mild to severe. So most people, about 80%, have a mild disease and they don't need to go to the hospital. 15% need some type of hospital care, usually meaning just some oxygen or supportive care, and then 5% would need an ICU. So who is at a higher risk of severe disease? So from the CDC's website, they list a few different groups. So people over the age of 65 years old, people who live in a nursing home or a long-term care facility, and then people with certain conditions such as chronic lung disease with moderate to severe asthma, heart disease with complications, anyone who's immunocompromised, such as people on cancer treatment, people with severe obesity or a BMI over 40, people with uncontrolled diabetes, renal disease, or liver disease. So what about Parkinson's? So we don't have any data at this time specifically about how the virus affects people with PD. And as you know, Parkinson's disease is very individualized. So a person who's younger, has just been diagnosed, and is otherwise healthy, their risk will be different and less than someone who's much older, who's had PD for many years, and who has other health comorbidities like I mentioned on the previous slide. So patients with PD are not considered to be immunosuppressed. So we think that Parkinson's patients are not necessarily at an increased risk for getting the infection, but once they do get the infection, they would be at risk of severe disease. So as you know, Parkinson's can be worse with any type of infection. That could be just with a cold or getting a urinary tract infection. So we assume that that would be the same with someone with Parkinson's who got COVID-19. So if someone were to get COVID-19, we would expect that they would have more off time. So you'd have more of your Parkinson's symptoms. So you might feel slower, stiffer, that your medications weren't working as well. You might have a longer recovery than someone who didn't have Parkinson's, and rarely you could have hallucinations. So Parkinson's can affect someone's breathing. Typically, this is in more advanced PD. Not everyone has this, but Parkinson's can cause swallowing issues, which can cause aspiration, and this can lead to pneumonia. You can also get shortness of breath as an off symptom, and some people have more respiratory issues due to stiffness of the chest wall and decreased tidal volume or decreased ability to take in the same amount of air. And then some patients have respiratory dyskinesias or dyssynchrony of their breathing. So the goal is kind of to optimize the on state and a patient's medications to try and optimize their breathing status. So this is not just for COVID-19, but for any hospitalization. If you have PD and have to be hospitalized, it's so important to have an updated chart of your medications and supplements with the timing of administration. It's also important to have an updated list of all your medical diagnoses. And if you haven't heard of this before, there's something called the Aware and Care Kit, and that's just a little picture of it on the left there. This is provided by the Parkinson's Foundation, and it's a really helpful little kit that you can just grab with you if you have to go to the hospital expectedly or unexpectedly. It has a medical ID bracelet. It has a little magnet that you can put on the board in the room telling people that you have Parkinson's, that you need your medications on time. It just is a really handy tool for you to have. And be aware that if you do get hospitalized and for some reason you can't swallow normally because you're on you have a ventilator or because of your mental status, then just be aware that your medications might need to change from what they were before you went to the hospital, because you may need to get medications through a different route, through dissolvable tablets or through injections or something like that. And then have the number for your Parkinson's doctor and let the inpatient team know that number, and they can communicate with your Parkinson's doctor about how best to manage your medications. So some people have asked about if there were interactions between Parkinson's medications and treatment for COVID-19. So right now, there are no FDA-approved medications for COVID-19. There are some medications being used experimentally in the hospital, not as an outpatient, but once someone is admitted, if they have severe disease, experimentally, you might have heard people are using hydroxychloroquine, or otherwise known as Plaquenil. This has been shown to decrease the virus in patients with COVID-19. It can cause a heart problem called QT prolongation, where it kind of lengthens one part of the heart rhythm. So if you were to be treated by this, if you were admitted to the hospital, then your inpatient team would need to think about decreasing or stopping other medications that could have that same effect on the heart. So some of the medications to consider would be amantadine, quetiapine, clozapine, or some of the antidepressants. So this wouldn't be for you to decide. This would just be up to your inpatient team. All right, so for people who are at higher risk, what can you do? So of course, you need to wash your hands often. You need to keep space between yourself and others, and what's been recommended is 2 meters or 6 feet. You should avoid all non-essential travel. You should stay home as much as possible. And if possible, try to ensure access to several weeks of your medications and supplies. So make sure you check what medications you have at home and call your doctor for refills if you need it. But just so you're aware, I found this from the Colorado Division of Insurance. They're directing insurance companies to cover an additional one-time early refill of any necessary prescriptions. So you may be able to just get your prescriptions filled early. And you can talk to your insurance companies more about that if you have questions. And then of course, if you get sick, you should stay home and you should call your primary care doctor. All right, so when should you seek immediate care? So if you get emergency warning signs, then you should call 911 or go to the hospital. And these include trouble breathing, persistent pain or pressure in the chest, new confusion or ability to be aroused, and bluish lips or face indicating that you're not getting enough oxygen. So just for those symptoms, should you call 911 or go to the hospital. If you have mild symptoms, then you should just call your primary care doctor and ask them about how to manage it. You should not go to the emergency room. So the goal would be to keep you at home as long as possible, as long as it's safe, just to try to minimize any risk of going to the hospital. And then on the left, I have this little screenshot here of the CDC's coronavirus self-checker. So if you go to the CDC's website, they have a little self-checker that they'll ask you some questions about your symptoms and try and triage with you and help you decide about if you need to seek care or not. But if there's any question at all, I would advise you just to call your primary care doctor. So a lot of people have asked about if they should wear a face mask. So in general, people who are well should not wear a face mask. You do not need one. You should really only wear one if a healthcare provider recommends it to you, or if you're having symptoms like a cough, because then that means you would be at risk of spreading it to other people. What if I have a caregiver that comes to my home? So this is can be a challenging situation, but there are some things you can try to do. You should try and clean surfaces daily that are used frequently. You can try and minimize the number of caregivers that are coming in as possible. Wash your hands frequently. Make sure your caregiver is washing their hands and practicing good social distancing once they leave your home. If possible, you could see if they temporarily are able to move in, though of course that's not always possible. And then if the outside caregiver has symptoms, they should not come in. They should stay home and they should seek care. All right, so thinking about the future, unfortunately, we do not know how long this pandemic will last for. So if at all possible, try and call your Parkinson's doctors, your primary care doctor, any physicians you see, and try and turn those visits into telehealth if possible. If your providers are able to offer it, that's great. You don't want to be missing appointments if you don't have to, but try to not go into the appointments in person if you can. At this time, we don't know about immunity after the infection. So in similar coronaviruses like MERS, you might have heard of, that infection, people were found unlikely to be reinfected shortly after they recover. So we can, we can wonder that maybe that would be the same with COVID-19, but we just don't know at this time. We also don't know how long someone will be infectious for. So the virus can be present in the body for weeks after the infection, but that doesn't necessarily mean that someone is contagious. So this is just an evolving process, and scientists around the world and doctors are working to try and understand the disease, and we just don't have the answers to all these questions at this time. And this information is mainly from the CDC, so they're keeping that website up to date with what they know on a daily basis. All right, how to manage anxiety and depression and just general well-being in this time. So of course, this is an extremely difficult, stressful time for everyone. It's a time of great uncertainty. So you just need to try and take care of yourself the best that you can with, the limitations that we have in place. So you need to try and stay active, and this is so important for Parkinson's patients. As you know, that's the #1 thing that your doctor will probably tell you at all your visits. You need to stay active, and of course, this is so difficult. You can't go to your classes, you can't get outside, but we'll give you some resources, but as much as you can to try and adapt and do workouts from home. Anything that you can do is great. It's also so important to stay connected to people. So you should check in with friends and family. It's also difficult. You can't go see people, but there's so many wonderful ways to be in contact with people now through social media or FaceTime on your phone, or if you've used Zoom, there's lots of different ways that you can find to stay in touch with people. Another thing we just encourage you to do is to find enjoyable activities around the house. So you could watch movies, you could write letters, read books, listen to podcasts, tackle projects that you've been putting off, and try and see this extra time as an opportunity and something positive rather than, just focusing on being trapped at home. And then consider meditation or other relaxation techniques. And finally, just remember that you're not alone. Everyone, around the world is going through this right now. So, reaching out to other people and just being connected is so important. And then finally, I just wanted to share some resources for information here. Like I mentioned, I mainly like to consult the CDC, and that included that self-checker I showed you earlier. The Colorado Department of Public Health has really excellent information. And then some other resources would be the Parkinson's Foundation, the World Health Organization, Michael J. Fox Foundation and the American Parkinson's Disease Association. They all have specific pages dedicated to COVID if you wanted good information. And then these are just some resources for exercise, for apps that you can do at home, or you can use it on your computer for free fitness. A lot of them have free offerings for 7 days or 30 days. And again, it's just so important that you stay as active as you can at home. And then finally, these are some resources for meditation and resiliency. The Neuropalliative Care Center at the University of Colorado has a great website. And then there's just some other articles and apps that you could try if you were interested. All right, thank you so much.
Okay, thank you, Dr. Lee. That was very informational, which is what we need right now. So thank you to all of you who did send in questions prior to the seminar. What we're going to do is go through those questions that were sent in first, and that may answer a lot of the questions that those of you online have. What you can do, though, is to ask a question. There's two different ways to ask questions. So the first one is if you look to the right of your screen, there's a bar there, and there is a chat where you can type a message. So you can type your question in there. There's also a way to raise your hand, and once Dr. Seeberger is done answering questions, if you raise your hand, Elena will unmute you so that you can ask the question. We have about 300 people on the call, so please bear with us because we're obviously not going to get to everybody. This will be recorded, so you will have access to this on our website once the recording is done. But again, I will turn it over to Dr. Seeberger. She's going to go through the list of questions that were pre-submitted, and then we will open it up for questions after that. Dr. Seeberger?
Thank you. Also, Dr. Lee will be helping to answer these questions, so she's going to beam in as well. Do you want me to read the questions, or will you? I guess
I muted myself. Dr. Seeberger, if you want to go ahead and read them, that would be great. Thank you.
So many of these were answered in Dr. Lee's presentation. We specifically created some of the content based around these questions, but let me go through some of these wonderful questions that were sent in ahead of time. So the first was, is Parkinson's community considered an at-risk population, notwithstanding other medical conditions? And just let me reemphasize that we feel that you are not more at risk of contracting the coronavirus unless you're over 65 or have these other comorbidities that Dr. Lee talked about. However, if you do contract coronavirus, you may be in for a little bit harder course at a higher risk of having more significant complications just because of the respiratory status. And that we just don't have enough data about that to be able to know what people's true disease course may look like. The next was, is there information on how COVID-19 affects young onset people with Parkinson's? And again, there's just not enough data out there to answer that question. The consideration is that the younger and more robust your health is, the likelihood that you would have a milder course. And as Dr. Lee pointed out, 80% of people do experience only mild symptoms. So that's the vast majority of patients. So Dr. Lee, I'll let you take the next.
Would you mind reading the question?
Oh, sorry. It's often said that people with immune system compromise are more likely to experience more severe symptoms of COVID-19. Does my Parkinson's compromise the immune system? And do people with Parkinson's experience COVID differently in type, magnitude, or duration?
So as I mentioned, people who are immunocompromised would be considered in that high risk group for having a severe illness, but Parkinson's is not considered to be a disease where you are immunocompromised. So that being said, the second half of that question was, would the disease course for someone with Parkinson's be different? And we would think it would be, not because of the immune system, but because of other factors that you could have respiratory issues. Like I mentioned, if you have rigidity of the chest wall, it's more difficult to breathe. And just in general, that patients with Parkinson's, when they get any type of infection, it can take them longer to recover, and they can have, their Parkinson's symptoms can just get worse.
Okay. The next question set really focuses on medications. Should I be worried about reduced medication supply? And if so, what can I do to adapt? We're not getting any indications that the medication supply chain is threatened at this point. And in fact, as China kind of comes out of their illness cycle, they do produce a lot of our medications. We would recommend that you have 2 to 3 months of medication on hand. As Dr. Lee mentioned, the pharmacies may be able to give you an earlier fill. And I've not heard that the like MediScripts or Express Scripts, some of the kind of mail order, I've not heard that they've been refilling early, but I do know some of the local pharmacies are. And then Dr. Lee, do any of the treatments for COVID-19 interfere with Parkinson's medications? I think you answered that a bit in yours.
Yeah, so as I mentioned, there's not an approved medication at this point, but one medication they're using, hydroxychloroquine, otherwise known as Plaquenil, that they're using experimentally in some hospitals. It can cause a problem with the heart rhythm where it's called QT prolongation, where it elongates one part of the heart rhythm. And there are some Parkinson's medications that have low risk of doing that. But that would be, if you had severe disease and you were admitted and your inpatient team decided to place you on this medication, then they would take a look at your list of medications and decide about if they wanted to change those medications or not. So
Right.
that's nothing that you need to do right now about changing your medication regimen.
Okay, and that prolongation of QTC is not something trivial. If it gets too long, the heart can go into an abnormal rhythm that can't be sustained. So this is a very serious consideration. We've heard, doctors writing prescriptions for their families and people just taking their leftover malaria drugs, and this is just not recommended. One, it's not known to prevent it anyway. It's just being used experimentally to treat those who are very ill at this time. Okay, so controlling spread. How long before you may know that you have the virus or be a carrier? And then once it's been contained, will there be a large risk of going out in public?
So the onset for disease symptoms is anywhere from 2 to 14 days. So after you've been exposed, it's possible that you wouldn't even have symptoms until 2 weeks later. And then, once this has been contained, I think what we anticipate is that people will start going out more, and then there may be resurgences of people getting exposed, and it might kind of be this cycle for a little bit of time. Unfortunately, we don't know how long that's going to be for.
Yeah, I've heard that referred to as second wave. And in talking to our neuroinfectious disease specialist here at the university, what they've said is this physical distancing and kind of homestay that we're all doing now is really preventing this very rapid rise and high peak of cases so that we don't overwhelm the hospitals and overwhelm our ventilator capacity, so that we're trying to, as they say, flatten out the curve, so that not that they're trying to prolong this thing, but that they're trying to keep people in their homes and safe so that we don't overwhelm the hospitals. They suspect that we'll have a rolling back of restrictions over time, and when that is, we don't really know. But with that gradual rolling back of restrictions, we are going to start going back out. And at that point, we're just going to need to continue to be very vigilant about how close we are to people, making sure we have good hand washing techniques, not touching our face and our mouth and our nose in particular, and just all the things we've learned from this, we need to carry on into the future. Okay, taking action. So we talked about handling stress. And it sounds like the Parkinson's Association of the Rockies is going to have some awesome resources as well online for us, and including some exercise. How can you stay connected? I'm amazed. So we've been doing a lot of telehealth in the last 2 weeks, and I'm amazed that anybody can learn to do it. And obviously y'all are on this call, so you've got all the things that you need at your fingertips to be able to connect with others. I've heard of people having family nights, game nights, and all this stuff remotely. So I think that that's wonderful. So travel, when will it be safe to travel again? Any thoughts on that, Dr. Lee?
You know, again, I don't think we have like a set date, unfortunately. Oh, after April 30th, you should go on your trip. I think at this point, I would just advise people to be cautious. I probably wouldn't plan any big trips in the coming weeks to months. And especially for patients with Parkinson's, like we mentioned, you would be at risk of a more severe disease if you were to get COVID. So I think just being a little bit more cautious than the average person,
I agree.
and not doing non-essential travel at this time.
I agree with that. And then grab bag, the meaning of corona is crown, and she showed you a beautiful picture of that. We know the sun has a corona, and so that's an old Latin word. And she mentioned that coronaviruses have been around, I mean, for a long time, forever. I learned about them in medical school, but this is just a new form of the virus that our bodies haven't seen. Is there any blood type related to the risk of getting COVID-19? I didn't see anything like that in my research. Did you?
I haven't read anything specifically about that.
Okay. How does the virus affect the brain, especially a brain with Parkinson's? So this is a really interesting concept. I know the head of neuroinfectious disease is the chairman at our department. Dr. Ken Tyler has written some pieces for the American Academy of Neurology, and it does seem that the virus can cause headache, stiff neck, the types of symptoms that you would find with a viral, what we call meningitis, which means inflammation of the lining of the brain. We don't really know what the severity of those neurological symptoms would be, because the respiratory problems are so overwhelming when people have severe coronavirus infection that they really haven't expressed a lot of other neurological symptoms. There are reports of people having as an initial symptom feelings of apathy or lethargy, just kind of sluggishness, maybe a decreased sense of smell. Those are clearly related to neurological findings. So that's all I can say about that. There's not really been a lot of literature regarding neurological symptoms. Do you agree? Do you have anything to add to that, Dr. Lee?
Yeah, I would just add that that article that Dr. Tyler talked about and that you've mentioned, there's just basically one article that's been published from China about neurological symptoms with COVID-19, and that hasn't been peer reviewed yet. So I think we're just learning more every single day, and that everything's kind of a work in progress at this point. So I think there's definitely a possibility that there's neurologic symptoms, but we just don't know for sure.
Right. And I'm not aware of any neurological sequelae after people have had COVID-19. Are you? Have you read anything about that after they become well? Any?
I think we also don't know about that. I haven't read anything about that.
Just the length of recovery, as you talked about in your presentation. We just know even with the simple flu, people with Parkinson's are harder hit, it takes them longer to recover from that. And then there was a last question about someone's son who may have been exposed, but it sounds like the exposure was quite a bit ago, back in January. And then they're just wondering about him being able to go back out and look for a job. Well, unfortunately, he's under the same restrictions that we all are right now, the stay-at-home orders, unless he's in a critical business. I suspect that most people aren't doing job interviews face-to-face, so perhaps he can look online for some resources to help get work.
Okay.
That was it for the pre-submitted questions. They were excellent.
They were good questions, and there's a
Yeah.
few that have come in, so I will read the ones that have come in.
Okay.
The first one is, why should you not wear a face mask if you do not have symptoms?
It's not felt that the face mask will protect you from getting the virus. The highest levels of protection, face mask, the N95 that everybody's been hearing about, that does protect against airborne and droplet. Face masks just don't have that same level of protection, and we're really saving the N95 masks, and there's even levels of masks above that for the surgeons in the hospitals, the people that are operating the ventilators, and those healthcare workers that are on the front lines.
Okay.
Anything to add to that, Dr. Lee?
Yeah, I think one other thing I had been reading was that people who aren't trained to use masks, if they're not in the healthcare profession, so, usually they'll just be touching their face even more when they wear a mask.
Mm-hmm.
So that's just an additional reason why, if you don't have symptoms, we would recommend you don't wear one, because you usually end up touching your face more, and we definitely don't want that.
Yeah, I agree with that.
Okay, second question, what are the 3 drugs, amantadine, etc., used for?
3 drugs. What
3
were the
drugs.
other 3?
They only mentioned amantadine, so I'm not
Maybe
sure.
the ones that I had mentioned on the slide.
Probably, yes.
So amantadine is used in Parkinson's disease. Oftentimes we use it for dyskinesias. And then the other 2 medicines that I mentioned were, I think they were antipsychotic medications.
Oh, yeah.
And then the last class was just antidepressants. So those were ones that have a theoretical risk of QT prolongation.
Okay. And this is a really good question, because I think there are some occupational and physical therapy places that are staying open. So what do you think about continuing to participate in outpatient therapy during this time?
I probably would advise that you don't leave your home to go to outpatient therapy. I feel like you can get resources at home. Perhaps the provider can convert to a video platform to be able to lead you through your exercises that way. I think it's safest if you just stay in your home and do your therapy from home with your home exercise program or a virtual platform.
Okay. Yeah, I think that's a really good question.
Yeah.
So continuing on, and I'm going to completely butcher these 2 drug names, but is the hydroxychloroquine in the fluoroquinolone family? How bad was that? Did you understand the question?
Yeah, I don't think they're in the same family. Yeah, hydroxychloroquine or Plaquenil. That one is used as an anti-malarial drug, but in the fluoroquinolones, those are antibiotics. So I don't think it's in the same class. I'd have to double check that, but I think they're separate. They just sound kind of similar.
They do. We are taking the malaria drug and also taking losartan. Should we stop with the malaria drug?
I would want to know more about that situation. So some people are on that medication. I mean, if you were prescribed it for malaria, or if you were prescribed it for a rheumatologic disease, then you need to talk with that doctor about who's prescribing it for you. But I would not take that medication as prophylaxis or prevention against COVID-19. And then losartan is an antihypertensive medication in the ARB class. I know people have talked about there's a certain receptor on the COVID-19 virus that it attaches to the ACE2, and I think that's why people have been talking about taking these classes of antihypertensive medications, but I don't think that that has been proven either to prevent getting the disease, if that's why someone's taking that medication.
So would you recommend that that person then call their doctor and have a conversation about that?
Yes,
Absolutely.
definitely.
Okay. Next question, will it be possible to use the COVID-19 test to determine whether you have had a mild case and have recovered?
I'm not aware that they have an antibody test to show past infection. Are you, Dr. Lee?
No, so the testing that they're using now that I'm aware of, it's called PCR, or polymerase chain reaction, and basically it tests for the presence of the RNA of the virus. So if that virus RNA isn't present in your swab, then they wouldn't be able to detect it.
Got it.
I think
Okay.
it'll be interesting to hear what Cindy Kirkendall has to say about their new product. That's the first I've heard of that, so that was really interesting. So I can't wait to hear more.
Okay. And we can have Cindy come back on and say something very quickly too about that at the end. Let's see. So next question, is there data on how many people with Parkinson's have contracted COVID? And unfortunately, I know the answer to that.
Yeah.
And is there a mechanism to gather data specific to Parkinson's?
I have not heard of anybody following those cases specifically. Are you aware of any other resource?
I am not.
Okay.
We have a hard time tracking how many people in our state have Parkinson's, so I don't anticipate that we would see anybody most likely tracking this with COVID either, unfortunately. So it may be something that we do surveys after the fact or try to get data from the doctors as much as we can after the fact. Next question, if you have been having a headache and sore throat, should you contact your doctor?
Yes.
Yes.
Yeah, your primary care doctor.
Yes. Okay. And I will say, like you mentioned, telehealth. So there's a lot of insurance companies and doctors who are doing things online. So a lot of insurance companies out there actually have a nurse that you can talk to. So always check with your insurance company and see if there's somebody that you can talk to as well. If you can't get through to your doctor quickly, just for those easy questions, but then always check with your doctor. But there are some questions that are easy that can probably be answered fairly reasonably. Is that true?
I would say yes. The amazing thing about what's been going on in telehealth on our campus, and I think all over the country, is that because we're in a crisis, there have been restrictions that have been lowered. We were not able to see Medicare patients via telehealth prior to this emergency, and now we are able to. They've lowered those barriers for us, so it's been incredible to be able to do these visits in people's homes and to reconnect with people. I had a woman that all I saw was this much of her head, but she was online, and we checked her DBS battery at home, and she was on replacement indicated within the next month or two. And so it ended up being a very fruitful call because we had to kind of troubleshoot when we could get her back in. Is this elective surgery? Is this not elective surgery? And that was a very good it was a very good call, and if she hadn't have gotten on, we wouldn't have been able to go through that. She was able to show me her programmer and things like that. at the University of Colorado, we are doing our last few battery replacements today for about a month. And then as people's batteries need replacement, we'll start to add on those cases in batches, probably more toward the end of next month. Of course, if somebody's battery is wearing down and they're not having enough benefit, they need to contact their docs so that we can supplement them with more medication. We just don't want them to discharge their battery suddenly, because that can be actually a life-threatening emergency in rare cases. So we just need to stay in touch with everybody, particularly in this time that have DBS.
Okay. Is it advised, oh, hang on a second, she's pasting questions so quickly, I have to keep backing up. Let's see. Loss of smell and taste are early markers of COVID. PD patients also suffer from these losses. Are there other best case early markers?
I haven't heard of any other early symptoms. I think just the most typical ones would be the ones I mentioned. So fever, cough, and shortness of breath. Those are the ones to keep an eye out for.
Yeah.
Okay. And then what are your thoughts about using zinc tablets?
I'm not aware of any literature.
Yeah, I had heard that, but I don't think that has been substantiated.
Okay. Is it advised for people with PD to go out for groceries, or better to just stay home?
So I'll let you handle this one. Dr. Lee and I talked about this a lot this morning.
Yeah, I think that's really difficult. I mean, you need to be eating. Don't want you to not eat. If you're at all able to have food delivered to you, I think that could be a really great resource. And people have asked about, oh, is that safe to receive food? You know, the delivery people might have been touching it. And I looked it up on the FDA to see what they were saying, and they basically said that's fine. You just need to make sure you wash your hands after you handle the food and before you're eating. So just frequent, diligent hand washing, I think, is sufficient. I think if you go to the grocery store, you know, you just need to understand that that's a small risk, and you should just wash your hands as soon as you get home, and make sure while you're at the grocery store that you're keeping at least 6 feet away from other people if you can.
I think also limiting the time that you're in the store, not just wandering around, but having a detailed list and then just get in there and get out. We've heard from others that they're throwing away delivery bags, they're throwing away the wrappers, maybe even they're going as far as wiping down the containers of food. You know, we're all just making it up as we go, right? We know we need to be clean and hygienic. We don't know who's a carrier and who's not, so we're just all trying to maintain our distances.
Okay, and we do have a person who wants to ask an in-person question. Elena, do you want to unmute them and announce them?
Sorry.
Hello.
Okay. So we have Tom Dreyer here. Oh, sorry. Can everyone hear me?
We can hear you, yes.
Okay. So we actually have Tom Dreyer on the line who raised his hand for a question. Tom, do you want to go ahead and ask a question?
My wife and I watch 3 grandkids 1 day a week. I'm 65 years old, had PD for about 20 years, doing fairly well. We've stopped watching them as of 2 weeks ago, but it's going to kill us. What would you advise?
I think you've done the smartest thing you can do, and I would suggest that you continue to make your self physically distance from your grandkids. It's just they may be carriers, they may have such mild symptoms that it's not known that they have it. I think you've done the right thing, and I think you should continue that probably for at least another month, depending on how this goes. Pick up your Zoom, you know, do everything you can to connect with them online. I know it's killing you. That's a hard one. But we, I've heard a similar question about family dinners and, just getting together with the grandkids and the other family members. It's just at this point, it's just too risky for you to do that.
I was afraid you were going to say that.
I know. Sorry.
Okay. All right.
That's
Thank
all
you,
right.
Tom. Okay.
Yeah,
All right,
thank you
thank
so
you.
much. Great question.
Okay, so I'll go back to some of the recorded questions that we've been having people ask. I'm not
Okay.
sure if we're going to understand this one because it's something about a report this morning, which I didn't see. So
Okay.
this morning, TV reported research on AB and even using such plasma for treatment. Have you?
Antibodies?
It must be. It just is. It's an abbreviation. That's why I said I did not see this report. So, do you know anything about antibodies and plasma for treatment?
Yeah, I don't.
I've heard that that's an idea, the same way like using a vaccine is an idea at this point, that if we could make a vaccine, that would prevent it. Or if you could treat people who, with the plasma of people who had already been infected and take out the antibodies that they had. I think that's like the hypothetical idea, but I don't think that that's available as far as I'm aware.
Okay. And then
the
second,
wonderful thing is there's tons of research going on, and we know even for being apart from our families that this is not forever. So we just have to kind of wait for those breakthroughs and wait for this wave to pass.
Yeah,
and
I just wanted to add that I looked on clinicaltrials.gov last night because I was just kind of curious what research is going on, and I think there were 150 trials.
Oh, wow.
Right now, which is amazing. So if you guys, anyone can look at that website is accessible to everyone. So you can see what research is going on and where people are enrolling.
And Dr. Lee, can you say the name of that website one more time?
It's clinicaltrials.gov.
Thank you.
And you can look up any disease too. It's not just for COVID.
Yeah. So that actually goes with another question that was down here a little further, but I'll ask it now. Are all Parkinson's clinical trials and studies on indefinite hold?
Oh, wow. Okay, so we should have said this up front. They sent our research coordinators home. I want to say it was about 2 weeks ago. Most of the docs are still coming in to the office, but we haven't had in-person clinic for about a week now. They're furloughed, I think, until the 15th of April. We are not enrolling for any of our clinical trials right now. Everything is on hold. I think we'll reassess mid to late April what that looks like. So if you had been contacted about a clinical trial and you were eager to get going in a clinical trial, just know that we have your name, you're on a list, and we're just not enrolling anybody. As far as whether I'm still seeing clinical trial participants, there are a couple of clinical trials that we're doing where the results are considered critical, rare diseases that have no cure, on what we would consider to be possibly neuroprotection. And so for those clinical trials, we're still seeing them in person as of last week. Those are starting to move into online platforms with blood draws locally. So yes, the answer to that question is things are on hold quite a bit right now.
Okay. And then back up to one a little earlier, and I know this is a tough one to answer, but I think that people are going to have this a lot as our social distancing restrictions start to cool down a little bit. So I guess in the Telluride area, restrictions are already being reduced. How will one know a space is safe? And their example is gyms.
Oh, yeah.
I wasn't aware that they were lifting restrictions anywhere.
I hadn't heard that either.
Yeah, that seems a little premature right now. I would just say there's unfortunately no way to know because, as I mentioned, your onset of symptoms can be 2 to 14 days after your exposure. So someone could be asymptomatic and contagious and they just wouldn't know. And so I would at this point still, even if they're lifting restrictions somewhere, I would be cautious and still practice physical distancing.
Plus, I mean, gyms are high touch contact surfaces, right? You're touching a lot of equipment that other people have touched. I just think it's a little bit more, it's a pretty packed environment. So I think that there are certain places that we're going to be able to go to earlier, like not going to big concerts or not going to big performances where there's, hundreds of people in the audience. So I think we just need to be smart about that.
Okay, we have 2 more hands that are raised. Elena, do you want to introduce those people?
Sure. So the first one we have is Barbara Smith. Barb, I'm going to go ahead and unmute you. Can you hear us? Maybe not. Maybe not. Okay. Well, Barbara, are you there? Okay. I will go ahead and move on to the next one then. The next person we have is Sherry Steiner. Sherry, I'll go ahead and unmute you if you want to give your question.
I think we may be having audio issues.
We may be having some audio issues.
Yeah. Okay.
Oh, that's too bad. Can she type the question?
Yeah. If you two can type your question down in the chat line, we'll get them answered quickly. And while you're doing that, I'll read another question here. So the question is, we have gone to my daughter's house and sat at a distance in her yard with our own chairs. Are you advocating to not do this?
Go ahead, Dr. Lee.
Yeah, I think, I think you just need to try your best to be smart about things and just recognize that, you might accidentally touch something or you might touch your face. And anything that you do when you leave is a small risk. And you just have to maybe accept that risk and try and do your best to minimize the risk. So try not to touch things and make sure you wash your hands when you get home. So I don't know. I think if you're being really good and for sure staying 6 feet away, then I think that could be okay. But we can't just say, oh, for sure, 100% that's fine to do.
Yeah, so I'm meaner. I would probably say don't do that for now. Just for all the reasons that we talked about earlier. We're gonna get through this, and for now we just need to be super safe. So I would probably say don't go there. I mean, we haven't let anybody in our home for quite some time. I consider myself a high risk person as far as contracting it, just because Dr. Lee and I are in the hospital. We're around people that are sick. So I have isolated myself for now a week or 2 from my neighbors. They invited me to come over and play Rummy Cube, and I was like, no, I can't do it. So I just would urge you to be cautious.
Okay. Okay, I know a lot of people are very interested in the COVID testing, so I'm going to have Cindy come on very quickly.
Great.
And talk a little bit more about what Abbott is doing with the COVID testing.
Okay.
Can you hear me okay?
We
Jody?
can, yes.
We'll post this as well. There's a great visual that explains a little bit more about the test. So we'll make sure and post that online after the call. But basically, it's a nasal swab, and then it's mixed with a reagent that allows us to identify a unique segment in that genome, and then it replicates that genome to a point where we can actually take a sample and we can get a very rapid diagnosis. And they're using what's called an ID Now platform, which is very portable. A lot of the emergency room departments have it. So it's really just being able to turn this test around in a very timely fashion in about 5 minutes. And as we all know, part of the problem has been just the number of tests available. So they're hoping to ramp this up, starting shipment today to a level of about 50,000 tests a day. And I think they'll start in those areas that are most affected. And then hopefully, you know, as we get access to more tests here in Colorado, we'll make sure and post that online too, so people know. But I think just knowing if you're carrying it, if you're asymptomatic, I think that's definitely going to help us be able to maybe slow the progress.
That's great.
Okay. And then just very quickly, one last question, which I'm just going to give the answer to. So right now, there are no office visits. It is all telehealth. So at this point, if you have an office visit scheduled, I'm sure they will be contacting you to set something up via telehealth and make it virtual. And then we're going to take one more question. We have one more raised hand. We're going to give it a shot. So Elena, do you want to go ahead?
All right, so we have Diane Green who has a question for us. I will unmute her and go ahead, Diane.
Okay, my husband Edward is going to ask the question.
Hi, my wife and I are 73 years old and I have Parkinson's. It's going to sound silly, but we have a grand dog that we used to like to walk. Can one get to the disease from petting a dog?
Okay, I'll let you answer that one.
So I saw on the CDC's frequently asked questions that they said that as of now we have no evidence of that the dog that could pass that, but that doesn't mean it can't happen. I just think we don't have evidence of that right now. So
What would you
again,
recommend?
yeah,
The dog lives
echoing,
with you, correct?
He does not live with us. He lives with my daughter.
Okay. All right. So does that mean you're going over to your daughter's house?
No. We've been isolated for at least 2 weeks now.
Okay.
She buys food for us and leaves it outside.
Oh, that's really that's great. Yeah. So how are you having contact with the dog?
Well, we haven't. My wife likes to take walks with the dog and hasn't done that since we've isolated. But I'm wondering if we're being too cautious.
Right. Well, I do know that people are getting outside and taking walks as long as they're staying away from others, and not amassing in crowds or being in places that are crowded. So that might be an option for you. I just don't know about the petting the dog. That's a tough one.
Right, the dog lives in a family with 2 teenage boys who get out a little bit. That family is self-isolating as well, but not as seriously as we are because they are going into stores. And that's where the dog is having contact. When I pick him up, we open the car door, they open the house door, and he shoots from the house to the car, but he's been in their house. So that's the issue.
All right.
I just don't think you can be too cautious at this time. You know, I would probably err on the side, like what Dr. Seeberger was saying, that, you know, as much as you can, just try to minimize that kind of contact. So, I don't know, maybe they can walk the dog and you can walk near them 6 feet away. You can still kind of enjoy its company.
Well, thank you very much.
Great question.
Thank you. I know that we are over time. Do you two have time to take a couple more questions at this point? I know you're both very busy. Okay. So the first question is COVID-19 seasonal in nature. Will it come back next fall?
Oh, so this is interesting, and I just actually asked the neuroinfectious disease person at our hospital this same question, and they just don't know at this point. He mentioned SARS kind of came and went. I mean, it doesn't ever come back. It hasn't ever come back since it was an epidemic before. So we just don't know with this particular virus what it's going to do.
Okay. Actually, that is the last question. So I think at this point, thank you so much, Dr. Lee and Dr. Seeberger. Oh, wait, sorry, one more. I was told there was 2. It just popped up. Does microwaving food kill the virus? That's actually a great question.
I haven't heard that.
Well, I mean, I've heard this as a rumor that when you get food delivered, if you take off all the wrapping and you take off all the bags and then you put it in the microwave for or for a minute, it kills the virus. But I'm not sure if that's just urban legend. I'm not sure there's any fact to that.
Okay. All right. Two more, and then we're going to have to cut this off. I know there's a lot of questions out there, and they're
I do
kind
want
of
to point
coming
out the
fast and furious.
medication forms that are to the right of the screen that that everybody should have. And then as the 4th one, hospitalization during COVID, this is a letter signed by your doctor that ensures that you'll get your medication on time and that the hospital won't change your medications unless they talk to your doctor.
Yes, and there's 5 forms over there, 5 handouts that you can download. One of them is the COVID-19 testing PDF that Cindy mentioned that kind of walks you through the steps of the testing process. And then I will talk about the exercise participant liability waiver very quickly here at the end. We'll take 2 more questions, and I'm sorry if we did not get to your question. This will be recorded, like I said, and available on our website. So the first question is, my husband is still working, but just 2 days a week. We still sleep in the same bedroom. Should I sleep in a separate room?
Is the person who's writing a person with Parkinson's?
It does not say.
Okay. I think if you're staying within your own home and he's taking precautions when he gets back in from work, they have asked us to wear washable clothes to work at the hospital. I don't know if he's in a high-risk industry or not, but just making sure that he, comes in, maybe takes a shower, sheds his clothes, and I don't think there's any problem with y'all being in the same house together. I mean, you're so communally related that even the sleeping in bed is just more of the same, sitting over dinner and all the other things that you're doing when you're touching and hugging and everything. So I don't think I would go as far as to separate you from the bed.
Okay.
I think the only caveat would be if that person becomes symptomatic.
Oh, sure.
Or sick.
Yeah,
then
I should have said that.
If you have a big enough house, if you have multiple bathrooms, to try and use separate facilities.
That's a good idea. If they're sick, if they're showing some symptoms. Yep.
And the last question is a 2-parter. The first one says that they've read that the virus feeds on ibuprofen and naproxen, but Tylenol is okay. Have you heard that, and what is your opinion?
Okay, we've also covered this morning. Dr. Lee, I'll let you take the front on that, our discussion.
Yeah, so I have heard that. I don't think that's necessarily feeding it. I think people have been saying or wondering that does taking ibuprofen, make the inflammatory cascade or somehow make you have more severe disease. And I think the question is unanswered at this point. People aren't sure if that's a causation, that you take ibuprofen and then you get severe disease, or if it's just an association that someone was taking ibuprofen and then they happen to get the severe disease for some other reason, and then you attribute that mistakenly to the ibuprofen. So at this point, we don't know, but some health ministries, I think it's mainly in France, are recommending using Tylenol instead, or acetaminophen, just because it can have the same kind of benefit of fever reduction, but then doesn't have this possible adverse problem.
And I would concur with that. If you're feeling nervous about it at all, just take acetaminophen instead, watching the amounts that you take based on the guidelines on the back of the bottle. It's important for you to lower fever because having too high a fever can be dangerous. So you don't want to avoid those medications. You just may, if it makes you a little nervous, take the Tylenol instead.
And then the second part of that is I have DBS and really need an adjustment. My doctor will only do telehealth visit. So what should I do?
You're just going to have to wait it out through this time frame. We were trying to, as we were coming into this, give people multiple programs that they could try when they were at home. We were also giving them a little bit more range on their amplitude so they could go up a little bit more while they were at home. But we weren't able to see everybody before the largely the clinic shut down. So you might need to supplement with medications during this time if you're not optimized with your DBS. So I just suggest that you contact your Parkinson's doctor and talk those things through.
Okay. Thank you so much, Dr. Seeberger and Dr. Lee. That was extremely informative. I appreciate your time today. Just to very quickly go through what the Parkinson Association is offering online. We have tried to take as much as we can to a virtual level. So we now have exercise classes that are virtually online. If you have not signed one of our exercise participant liability waivers, it is part of the downloads on the right-hand side. You can sign that, send it in to us. Elena Kustler is who sent you the email for this particular webinar. You can send that back to Elena and she will give you a list of all of the online classes. Also on our website, if you go to the first page, there's a big red bar at the top. There's actually a link on there that will take you to all of the educational seminars. It has third-party exercise classes. Dr. Lee covered a lot of those in her presentation. And then it also has support groups and anyone else who is doing virtual meetings at this point. So our goal is to keep you as connected and informed as possible during this difficult time. We are sending out 2 e-news a week, which we normally do not do. But that's giving you a lot of ideas for things to do at home. It's giving you a lot of resources that you can go to. I know a group of my friends has started a virtual book club. So there's some easy things that you can do online to stay connected with your community. You can go, if you're not getting that e-news, please go to our website. It's www.parkinsonrockies.org. The Parkinson is singular, the Rockies is plural, and sign up for that e-news and you will start getting those bi-weekly. And with that, I am going to end the webinar. Again, we appreciate your time, Dr. Seeberger and Dr. Lee. This will be recorded and you will be getting an email with the recording information. It will also be on our website.
Thanks you guys for all your great questions. Stay safe out there.
All right, thank you.
Bye.
Bye.